Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Currently, I'm a member of the International Progressive MS Alliance Scientific Steering Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. Thank you to all of you who are joining us on GoToWebinar, Facebook Live, YouTube Live, and Twitch. The MS Society's Ask an MS Expert webcast is designed to connect you with MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. So as I chat with today's expert, please feel free to post your questions in the GoToWebinar chat box, and we'll try to answer as many of those questions as we can during the Q&A portion of today's program. And the Society's MS navigators are also online throughout today's program, answering questions and connecting you with resources. Whether you are new to MS or want to learn more, we're here to provide you with reliable, up-to-date information to help you navigate through your MS journey. Today, Dr. Nancy Hu is joining us to talk about some of the things you'll want to know if you've recently been diagnosed. She'll share some tips for taking steps to manage your MS, how to work with your MS care team, and how to build resilience. Dr. Hu earned her medical degree at Georgetown University, and now she serves as director for the neurology clerkship for Georgetown University Medical School. Dr. Hu co-created Georgetown MS Center's Outreach for Wellness in Newly Diagnosed Young Adults with Multiple Sclerosis, known as the OWN MS program. These educational events focus on empowering people living with MS by fostering the development of wellness and improving their ability to communicate with family, friends, employers, and other healthcare providers. Welcome, Dr. Hu, and thank you for being with us today.
Hi, thank you for the opportunity to be able to connect with you and the MS community today.
Now, everyone's MS journey is different. There are things people need to know right away and other questions that might actually arise over time. Getting the right information can help people living with MS cope with changes and challenges as they occur. Dr. Hu, maybe a good place for us to start is by having you explain what MS is and who gets MS.
Of course, I could not agree more. It's a great way to get the discussion going. I do recognize that this disease can be frightening to process and intimidating to learn, so I'm happy to share information to guide one's journey with the disease. So multiple sclerosis, or MS, is an autoimmune condition that affects the brain and spinal cord. So the immune system is a part of us that's intended to protect, right, from infections like bacteria and viruses, and even help screen for outsiders like precancerous cells. So in order to do this well, the immune system is supposed to be able to distinguish self from non-self. And unfortunately, in MS, the immune system just gets erroneously activated and unfortunately targets one's own nervous system. So that's why the immune system will cause inflammation that damages the myelin, or the otherwise known as the insulating coating around our nerves, which is why you'll hear the term demyelination. It's a fairly common disease affecting 1 in 300 Americans, and generally affects younger people more than old, typically around ages 20 to 50, which is actually a critical time because that's when a lot of individuals are, forming their identities, building careers and starting families of their own. While MS does affect more women than men, it is important to recognize that men get this disease too. So the female to male ratio is thought to be about 2 to 1 or 3 to 1. So meaning that out of 3 MS patients, 2 would be women and 1 would be a man. MS does affect many ethnic backgrounds, including Caucasians and African Americans. and definitely geographical preferences for people who live further away from the equator. So while discussing these populations of people who are more commonly affected by MS, I just want to be careful and just share that there are people who don't fall into these categories who also get the disease. Especially during these current times, the medical field and those teaching are paying attention to how these racial and gender biases and differences can potentially result in disparities.
We've heard from Laura, and she wrote in asking, why is everyone's MS so different? Can you tell us what makes MS so unpredictable?
So when I work with medical students, I often start the experience by highlighting how one case of MS is one case of MS, as differences can arise from different symptoms, resulting, depending on where the demyelination occurs. Differences arise from the different timing of diagnosis and how one is treated, even in terms of outlook of management. It's unpredictable because there's a whole host of various factors that can trigger such inflammatory MS changes. So when discussing the diagnosis, I flat out acknowledge how it's difficult to cope with such uncertainty, right? Not knowing what's to come really makes it difficult to plan. But instead of feeling helpless or even hopeless by such doubt, I try my best to empower patients to control what they can control, right? To do anything they can possibly do to put the odds in their favor, to kind of temper down the anxiety. With such unpredictability and differences, it's also helpful to know that what happens to other people may not necessarily happen to you. But even if it does, you'll deal with it.
So given the fact that symptoms can be so different, so varied, how is MS diagnosed?
At this time, we do not have a single test to determine the MS diagnosis, but we do clinically diagnose it with a detailed neurological history and physical exam. We then combine that with MRIs of the brain and spinal cord. Sometimes we do blood tests to rule out MS mimickers like B12 deficiency, and sometimes spinal taps or lumbar punctures to collect fluid can help us determine the diagnosis. And we have certain criteria met that allow us to make the diagnosis. Currently, we use the McDonald criteria that was just recently updated in 2017 that involves separation in space, so meaning two different parts of the central nervous system are affected, and separation in time, meaning that there's been at least two periods within one's course, or things have been progressive over 6 months' time. It's also imperative just to rule out other potential explanations for signs and symptoms.
Jennifer was diagnosed with MS last month, and she's wondering what caused her MS. What do we know about what causes multiple sclerosis?
Yeah. So we don't know what exactly causes it or can point to one specific entity, but there are theories that relate to genetic risk factors, even considering how the risk for developing MS may depend on environmental triggers, right? Things we're exposed to as infections like the EBV virus that causes mono, low vitamin D, even smoking. And I think this question is important because I think patients ask because they want to know if they did something wrong, if they could have done something to prevent MS. So I just want to comment, you don't need to feel guilty because we don't know everything that contributes to the diagnosis. And it might actually be helpful to kind of redirect questions to what can be done here, now, in the moment, and in the days ahead to just deal with the diagnosis in the most effective way.
Some people may have heard their doctor use the term clinically isolated syndrome. What is that, and will people who are diagnosed with clinically isolated syndrome develop MS?
So, clinically isolated syndrome, or CIS, describes the first episode of neurological symptoms that last at least 24 hours that's caused by inflammation or demyelination. So CIS, because it signals the first attack, usually prompts evaluation to determine whether or not one's likely to develop MS in further recurrent episodes. So with CIS, patients are typically referred to get an MRI. And with such imaging, we can actually stratify people into low or high risk based on whether or not there's other brain lesions detected. In some people, the MRIs can actually quickly transform the CIS diagnosis to MS if there's evidence of older lesions that occurred in different locations. So CIS is basically an opportunity to timely and accurately diagnose early MS so that we can begin treatment as soon as possible.
There are different types or subtypes of MS. Can you explain what those are?
Of course. So we have general terms, umbrella terms of relapsing and remitting and progressive. So relapsing remitting MS describes what most MS patients experience in terms of episodes of neurological symptoms that last for days, weeks, even sometimes months, that then recover. And the other umbrella term of progression just describes gradual worsening. So such worsening can actually occur at the onset diagnosis, where it's termed primary progressive MS, or the progression and gradual worsening can evolve and kind of follow from an initial relapsing remitting course. So that's what's termed secondary progressive MS.
Frank was diagnosed with MS 2 years ago after he experienced vision problems, and he's wondering about what other symptoms he might experience. While MS can be different for everybody, are there some common symptoms in MS?
Okay. So using what we know about MS causing inflammation to the brain and spinal cord, MS can disturb anything along that narrow axis. So common symptoms include vision symptoms like blurry vision, loss of vision, even altered color vision. It can include weakness or muscle tightness, numbness or sensory disturbances, sometimes incoordination of balance, memory issues, fatigue, bladder dysfunction, even sexual dysfunction. And just know that I don't mean to scare anyone with this list of symptoms. These are just varied ways in which one can present. And I'm not at all saying that one will develop all these hosts of complaints. And also, considering how these same neurological symptoms can be caused by other diseases that affect the brain and spinal cord. So it's really important to get evaluated by a trained neurologist to determine if there's a specific pattern that's actually more suspicious for MS.
Before we continue our discussion, I just want to take a moment to welcome those of you who have continued to join us. Please let us know what's on your mind. Type your questions into the question or chat box on GoToWebinar. We'll address as many as we can during the Q&A portion of today's program. And MS navigators are online throughout today's program, answering your questions and connecting you to resources. Our Ask an MS Expert program takes place at this same time every Friday. So please help us make sure that everyone knows about it by sharing news about the webcast with your family, your friends, and on all your social media channels. Once people who are newly diagnosed with MS process their diagnosis and learn some of the things that we're discussing today, they often wonder how to start taking action. Mike says he's been experiencing numbness in his right arm for the past week, and he wants to know if he's having an MS relapse. Dr. Hu, can you explain what an MS relapse is and how it's different from what's called a pseudo relapse?
Of course. So an MS relapse, it's an episode of neurological worsening or new symptoms that last more than 24 hours that signal new inflammatory demyelination in the absence of any fever infection. So you actually might hear an MS relapse referred to as an attack, an MS exacerbation, or even an MS flare. Same terms to just basically describe how there's new inflammatory changes that can actually present in a variety of ways. So, painful vision loss in one eye can signal injury to the optic nerve. Weakness or numbness on one or both legs can signal injury to the spinal cord. Numbness or weakness in one half of the body can signal injury to the cortex. Even vertigo or difficulty walking can signal injury to the brain, to the cerebellum. So contrast is to MS pseudo-relapses, which typically involve old symptoms that actually just worsen in the context of fever infection or even trauma or stress. And with MS pseudo-relapses, the worsening is not due from new immune activity, rather just damage from previous inflammation that just acts up with stressors that lessens one's ability to compensate for existing damage. So it's really hard to distinguish sometimes between a true MS relapse and a pseudo-relapse. So definitely reach out to your MS provider if you're concerned so that we can tease out and ask, investigate certain clues as it relates to symptoms, the localization, even timing, whether or not it's constant or fluctuating, and asking about any changes that might be provoking activity. We might ask you to come into the office to be examined, and sometimes we order an MRI with contrast to look for any changes if necessary.
Mike is also wondering whether there are treatment options for MS relapses.
Yeah. So with MS relapses, just rest assured that recovery will occur on its own even without treatment, but a mainstay of treatment is the use of steroids. So these are high doses administered either intravenously or by mouth, and they work by calming down the inflammation and basically hastening the rate of recovery. So you get better faster, though the extent of the overall recovery does not change. It's important to know that steroids are not always used, not always necessary, just because it does require an evaluation of benefit versus risk, as they do carry side effects like immunosuppression, weight gain, blood pressure changes, even difficulty sleeping. With MS relapses, we may recommend being admitted to the hospital, getting physical therapy involved, and even beyond treating the episode, it's important to consider how we better prevent future relapses. So this actually may prompt a change in your disease-modifying therapy.
Speaking of which, Susan wrote in that her doctor gave her a list of medications that he called disease-modifying therapies and said that she should start one right away. So what are disease-modifying therapies, also called DMTs, and should everyone diagnosed with MS start a DMT?
DMTs are treatments that target the immune system to make it less likely for relapses to occur, to delay the progression of disability, and to limit new activity seen on MRI. Generally, we do encourage patients to start DMTs right away, just because if delayed too much, the concern is that people don't catch up in terms of overall disability compared to those who started active treatment earlier on. There is concrete scientific evidence that shows that early and ongoing treatment with DMTs is the best available strategy to optimize the quality of life for MS patients.
I think that's a really important point. Unlike taking an aspirin and seeing your headache go away, when you start disease-modifying therapy, you may not notice any difference, but as you just pointed out, down the road, it'll slow down your progression and extend your best possible quality of life, right?
Yeah, definitely. Well put.
Well, how does someone, given the fact that there are like 20 disease-modifying therapies available today, how does someone go about choosing the right one for them?
Yeah, so I chuckle because I feel very fortunate to be able to practice at a time when the issue is trying to make sense of too many options, right? Compared to 20, 30 years ago when there was an issue of lack of available choices. So trying to navigate the various options, each of these drugs do work in different mechanisms to kind of quiet down the overactive immune activity, thereby, preventing relapses and progression. So many factors kind of go in, and it's not like, cancer where we can draw a blood test and determine a biomarker to know which type of medication you're going to best respond to. Instead, it requires a very honest dialogue between the patient and the provider to kind of bridge what the goals are. So choosing the right DMT involves a discussion about the relative efficacy of the medication that factors in how active one's MS is in terms of relapses, even where the MS is affected in central nervous system, like the brain or spinal cord. Patient preference of how medications are taken is definitely important to talk about, as we have injectables, we have pills that are taken once or twice a day, and infusions that can be administered once a month or even twice a year. Side effects also very much color what medications might be a good fit. And choosing the best one is an individualized process, right? And it's also important to kind of note that your best therapy might actually change with time. So again, goals change with life. We're rapidly advancing new technologies in terms of the mechanisms of disease-modifying therapy. So that's why it's important to have a good working relationship with your MS specialist.
Well, besides disease-modifying therapies, people living with MS may need other medications to help manage different MS symptoms. Can you share some examples of MS symptoms and the medications that might treat them?
Yeah, of course. So treating MS effectively requires multiple strategies, right? So while DMTs are a major strategy focused on preventing new symptoms and disability, they don't treat existing symptoms. So that's why we have symptomatic treatments that are essentially like putting on Band-Aids, right, to cover up old symptoms to improve quality of life. So for example, spasticity or muscle tightness, you could take pills like baclofen or clonazepam, even get injections, once every 3 months, like with Botox. For sensory disturbances like tingling, burning, electricity feeling, we can use anti-seizure medications, even antidepressants, as they act on the same neurochemicals and basically communications between nerves. Neurogenic bladder with frequency or urgency, you can take pills like oxybutynin or methadone, you can get Botox. And if one is suffering from gait difficulties or kind of endurance, dofamidine or Encura can be an option. So how to make sense of all those choices, right? In addition to the DMTs, but ultimately what guides symptomatic treatment is just first identifying and communicating bothersome complaints, right? So patients will ask me, do I need to start one of these medications? And I often turn it back on them and I ask, well, how much is it interfering with your day-to-day? Because we won't know until we try. The selection of the agent really depends also if there's other symptoms that need to be addressed. For example, I use duloxetine or Cymbalta if someone's suffering from, sensory complaints and also some fatigue or even depression. And choosing the right agent also depends on common side effects. And even with initiation of treatment, it's important to talk to the doctor about, how to monitor for effects, how to determine if there's actually improvement in either frequency, severity of the symptoms, and kind of monitoring for side effects.
Sean shared that his neurologist told him to start a healthy diet and to exercise 3 times a week. What are the benefits of a healthy lifestyle for people living with MS? And Sean is asking for some wellness strategies that can help him live his best life.
I think we all need wellness strategies, right, to deal with the day-to-days. I'm just reminded of a quote, you can't pour from an empty cup, right? So wellness involves the various ways that we pour into ourselves, right, and help us feel at our best even when times are hard. At our events, we discussed how, wellness is this dynamic process of just becoming aware, right? Being able to make empowered choices towards a healthy and fulfilling life. And ultimately, every person's unique, right? Your definition of wellness may not be someone else's. So these strategies really focus on you being able to answer what makes you you, what do you value, and how does that help you prioritize things in your life. Then you can discuss, with providers and also peers about specific strategies for such self-care and self-management that can include, healthy diet, where essentially good energy in is good energy out. Exercise definitely improves mood, reduces fatigue, and improves strength. But on the topic of exercise, I do caution patients to listen to one's body and just not to overdo it. There is a phenomenon called UTOF phenomenon, where overheating can actually slow down nerve signaling and actually make old symptoms temporarily appear. But this usually gets better with cooling down and resting. I just don't want people to get scared off just because exercise can be very impactful in kind of slowing down all the changes. Besides diet and exercise, I can't overemphasize the importance of getting enough quality sleep, right? So I often share how, we function almost like a battery. It takes a certain amount to kind of get through the day, and sleep is one of the major ways in which we replenish what we drain. If people smoke, I try not to overlook that because it does contribute to an inflammatory state beyond the known respiratory, cardiovascular, and even cancer risks. And then ultimately, the key question is, how do we reduce stress, right? So this can mean different things for different people, whether or not it's just connecting with peers, getting massages, or even turning to spirituality. In those, there's opportunity to develop an effective support system, to not feel alone. And I think And on, kind of dovetailing of that, not feeling alone, working with your healthcare providers and having regular checkups just to be able to attend to these health needs is key.
Circling back to the importance of a healthy diet, is there any specific diet that's recommended for people living with MS?
I chuckle. I often say the best diet is the one that you stick with. um, so at this time, there's no scientific evidence to promote one specific way of eating compared to others, though it is generally recommended to avoid processed foods, eat balanced diets with fruits and vegetables, and to avoid a lot of animal fat. Some people try to avoid gluten, but that can be hard given how widespread it is. So ultimately, I ask patients to kind of maybe choose one food that they would try to eliminate or modify and evaluate if that makes a difference over 2 weeks' time, and make incremental changes just so that even changes related to diet can become habits that don't become too intrusive.
Do you recommend any supplements to your patients?
We definitely do discuss supplements as people are looking for complementary ways of treating their MS without use of prescription medications. As many people are deficient in vitamin D, D3 is commonly recommended as it can actually help regulate the immune system. B12 is a consideration too, especially if levels are low, just because it helps our body, maintain the myelin coating around our nerves. And a lot of my patients will say that they take B complexes because it helps with their energy level. But with all these supplements, I do caution that there can sometimes be too much of a good thing. For example, if you take too much B6, you can actually get sensory disturbances. And I know zinc is actually very popular now because it's used to fight off infections. But too much zinc can actually cause a copper deficiency and actually neuronal injury to the central and peripheral nervous system. I try to be careful with my words too, just because the FDA does not help us regulate these supplements. So with this, I encourage patients just to, when discussing medications, just make sure to discuss over-the-counter supplements that one is taking, especially the dosing.
Are there any activities that someone newly diagnosed shouldn't or can't do because of their MS?
So typically with newly diagnosed patients and minimal accrual of disability early on, I really encourage patients just to live out their lives as unhindered as possible. So, patients will often ask, can I still drink and go out for social events? Yeah, but just be mindful about not overdoing it, right? If you're on certain medications that affect your liver. Patients will ask if they can travel. Yeah, it's just timing considerations might need to be addressed if there's any recent relapses or changes in treatment that require monitoring. And even in terms of living out one's life and developing one's own family, right? Patients with MS can still have children. It wasn't long ago that female patients were told not to have babies, and now we know pregnancy can actually have a relative protective effect during the first and second trimester if the disease is well controlled leading up to conception. So just kind of speaks to how the goal of treating MS now is just to kind of keep people not feeling limited for as long as possible, to be able to enjoy the maximum potential of life.
MS is a chronic disease that requires an ongoing relationship between the person with MS and their healthcare team. A comprehensive personalized treatment plan that's developed with a healthcare team can help people living with MS manage their symptoms, prevent complications, and maximize their quality of life. And we've heard from Carl, who wants to know, besides his neurologist, what other health professionals should be a part of his healthcare team?
So the team can consist of anyone who can help manage potential symptoms and optimize health. So commonly used specialists include physical therapy or physiatry to kind of help with walking and balance, even strength training. Occupational therapy can help if there's any issues related to activities of daily living or even use of your hands. We commonly use urogynecologists to help with bladder issues. Psychiatry can be helpful to manage mood symptoms, and there are neuropsychologists who help with cognition. ultimately, I feel like my role as a MS specialist is kind of to be like the quarterback, right? To kind of help check in and coordinate all of these different efforts to have the same goal of improving day-to-day function.
Marlo wrote in and she's asking where she can find a neurologist that specializes in MS.
Good question. So, well, I think if you were to Google MS specialist near me, you might actually be directed to a neurologist who just lists MS as one of the conditions he or she treats. But that's very different than treating a neurologist who's actually completed additional training and dedicated themselves to the subspecialty of MS. There's a lot of nuances, a lot of advances, and a lot of time that it takes to be able to care for MS patients well. So I know that the National MS Society has actually been very helpful in identifying, there's partners in MS care who, they kind of review and determine providers who have demonstrated, a lot of knowledge and expertise. They also give credit for, centers of comprehensive MS care, those who are actually exceptionally skilled at coordinating multidisciplinary services just to provide exceptional care. But, even amongst MS specialists, once you find one, you should additionally consider whether or not the provider is a good fit for you, right? So like you said, MS is a lifelong condition. It's like building a relationship. So building a relationship with your doctor or nurse practitioner is like choosing a life partner, right? So just like the dating pool, not all MS providers are alike. So it might take a bit of, quote unquote dating to find the right care partner for you. So, be honest with whether or not you feel comfortable with their level of expertise, what their treatment options are, if they're kind of, work with you, or if they're more paternalistic and tell you what to do. Just whether or not you feel like you can open up to them with their bedside manner is especially important. And definitely their office practices and ease of access and communication should be factored in. I think that's what I'd recommend.
So assuming you've identified that neurologist, can you share some pointers now about how someone living with MS can make the most of his or her visit to that office?
Yeah, so again, with the relationship that's going to build, be willing to be open and evaluate trust with your neurologist, because they're going to be working with you to continue and monitor treatment. As a neurologist and basically medical detective, right? I am only as good as the clues that I get. So the clues are what the patient shares in terms of symptoms, even what I'm able to elicit on exam, and even, listening to what providers recommend in terms of blood tests and MRIs also help me provide meaningful recommendations. Before your appointment, it is important to be prepared. If seeing someone new, just try to make every attempt to share records ahead of the appointment, so that they can kind of get a sense of what notes and prior results, blood tests, spinal taps, even with MRIs, if you're able to get the discs themselves. Many of us like to be able to look at the lesions and compare and contrast on our own rather than purely relying on reports. So beyond these type of records, I think keeping a health diary in terms of maintenance can be impactful, right? Brief notes on what the symptoms are in between appointments, whether or not there's been any changes, any responses to the medications, and whether or not there's other things going on like illnesses or stress or even fatigue. Aside from being prepared, I think just ask questions, right? Be an effective partner. Be educated about MS, because while the MS specialist can help guide choices, you as the MS patient are living the consequences of such choices, right? Day in and day out. So if you, along those lines, if you're comfortable and the practice allows for it, consider having a family member just be in the room too, to be an extra set of ears and an extra, source of questions that you may not think about at that moment. And then I think the last thing I would just comment on is try to schedule regular appointments, even if you're feeling well. So besides symptoms, we do perform exams and discuss the need for lab and MRI. And appointments are also opportunities to check in regarding advances in the field. For example, our yearly American Academy of Neurology conference starts tomorrow. So hopefully I could provide updates during such appointments.
Well, I think you almost started to answer this next question, but I'm wondering if we can talk for a minute about shared decision making. What does that mean, and why is this concept of shared decision making important for people living with MS?
Yeah. Building off of what I commented on earlier, it just speaks to the patient and the neurologist working as a team with a shared goal of living out the best life possible for the MS patient. Right. So as a provider, I feel like I am responsible for engaging and listening to the patient, learning about their values and what their preferences are, so that I can then educate about disease and treatment options and help explore those, and ultimately making recommendations based on knowledge, experience, and even preference. And ultimately, it kind of goes back to having an educated patient who's responsible, right, for taking ownership of such informed decisions about how they want to take out their lives or, live their lives. Matching an ideal MS treatment really is a great challenge just because there's a lot of complexity and variability. But with such shared decision making, it's really an effective way to build a bridge, right, towards meaningful solutions for everyone involved.
I also heard you mention the value of keeping regular appointments, even when you're feeling all right. How often should someone see their neurologist, have labs drawn, get that updated MRI exam?
So at a minimum, I think that newly diagnosed patients should be evaluated at least once every 6 months for check-ins, right? Also to discuss the appropriateness of MRIs and labs. Though I will say the frequency of MRIs and labs may depend on the specific circumstances, like how active one's MS is, or even certain disease, the DMTs that we're using. And I also would add that it's not uncommon that I actually meet with newly diagnosed patients more frequently, especially in the beginning, just because there's so many different nuances and various aspects to kind of tease through, right? I'm very mindful too, where sometimes I have to just dedicate an entire hour-long visit just to review what an MS diagnosis is, right? Confirming it with history and testing and just discussing how it affects one's identity. And then just even following up closely to then discuss treatment options, just because we can only handle so much information at one sitting.
When and how to talk about your MS diagnosis is a decision that really varies from person to person. What are some factors that people might want to consider when discussing their MS diagnosis with others?
Yeah. So one consideration, just who you disclose the diagnosis to, because once you share it, you can't take it back. Most do start with those close family and friends, those people who probably already sense that something's already different. And the sooner it's addressed, the sooner dialogues can be initiated to kind of talk through concerns and kind of share experiences and to kind of feel like you have a support network. There's also newer relationships like dating, where it's people often ask, well, at what point do I share the diagnosis? And again, I hate to turn it back, but ask, when would you want to know significant information about the other person to kind of guide whether or not you want to be with them. Sharing and the opposite, secrecy. Withholding information can sometimes be misinterpreted and can actually cause burden in a relationship. While I understand that every relationship is different, I just kind of ask these questions so patients can be able to evaluate for themselves what feels right.
Beyond the patient themselves, an MS diagnosis will also impact family members, partners, and friends in different ways. Openly talking with them about their feelings and concerns is part of the process of adapting to life living with MS. How does MS impact someone's family?
So just like each MS patient is different, each family is different in terms of dynamics, right? So, but I guess I would imagine the same roller coaster of emotions, right, that MS patients feel, from disbelief, sadness, worry. Those same emotions could be experienced by family members. And similarly, how the types of emotions, how one copes, family members might cope in different ways, right? Some might want to ask a lot of questions, whereas some just kind of want to avoid the issue. And just being open to that. I think kind of allows for just compassion and kindness as we all respond to challenges and confusion differently. I actually asked some of my patients this question earlier this week because, I don't live the day to day. And one of them commented how her invisible symptoms were especially difficult to kind of deal with family members, right? Like not feeling yucky, feeling fatigue, but her, children interpreting that as like, oh, mom just doesn't care. Mom's not involved. When, that's not the case. It's just not an issue of feeling motivated. It's just that the disease is so invisible. So that's why having an honest dialogue can actually be helpful. And I think ultimately, while I respect a patient's willingness to disclose, I do think that just my definition of a strong family is one that relies on a foundation of, honesty, unconditional support, and compassion. So disclosing the information can actually strengthen such family bonds.
Well, we heard from Robert, who was recently diagnosed with MS, and Robert has 2 kids, 12 and 14 years old. He wants to know what are some recommendations for how he can share news about his diagnosis with his kids.
Definitely. So I think discussing the MS diagnosis with children really depends on the age and ability to understand, right? So, how you talk to a toddler is very different than how you talk to a teenager. So as this changes with time, the amount and even type of information will likely change. But, even thinking about toddlers, I know the question's about teenagers, but even as toddlers, kids are aware of life around them. So even if they don't know specific labels, they will likely pick up on changes that relate to physical, cognitive, or even emotional states. And ultimately, I think with teenagers, and more young adults, making sure you have protected time to have an exchange. I think, again, that asking questions and having answers, respecting everyone's perspectives can be extremely meaningful. And there's no one right way, though one of my patients did share how she starts her conversations by asking what the kids notice and what their worries are to kind of see how they can then bridge the conversation accordingly and kind of come together to deal with all the changes.
Calvin wrote in and said he has MS and his daughter was recently diagnosed with MS. And Calvin feels guilty because he believes that he likely caused her to get MS. Is MS inherited?
And so I hope that this response can provide comfort because MS is not directly passed from, parent to child. It's not purely hereditary. Even if a first-degree relative has MS, the risk for developing MS is about like 1 in 30, right? So if you're to have 30 children, one of those would have MS. So it's actually, less likely that children would be born with it. Even considering identical twins, the risk for the other twin would be 1 in 3. So again, just kind of speaking to how there's many factors that kind of go into it, and it's not purely hereditary.
Well, speaking of children, Anne says she's 27 years old and she was recently diagnosed. And Anne wants to know whether having MS will affect her ability to get pregnant.
Yeah. So patients with MS can still conceive and have healthy families. Though I comment that if, depending on the symptoms, there might be difficulties if experiencing neurological symptoms that affect sexual function, even sensory or motor. But at the juncture of contemplating pregnancy, I really encourage people to discuss this with an MS provider. There's many things to consider, especially how well MS is managed in the time leading up to pregnancy, as this does affect the likelihood for relapse. And we definitely would need to discuss how to modify DMTs and symptomatic medication use of becoming pregnant. But it is something as a regular part of my day-to-day and kind of navigating all these difficult and nuanced conversations.
Switching gears a little bit, I know that education and preparation are powerful tools when it comes to navigating employment options for people with MS. Can someone recently diagnosed continue working?
Definitely. So as long as neurological symptoms are not significantly interfering with work, please work as long as you're able to, right? Staying engaged with our employment just provides opportunities to exercise that brain-body connection, right? So as we communicate with colleagues, as we problem solve towards solutions related to work, and even just build up endurance with having to work, 8+ hours a day. I'd also comment on it's important to work just because if you were to give up such an important role, especially as many of us identify with our jobs, there can actually be new stresses related to stopping working.
Well, what are some recommendations to maximize employment options for someone diagnosed with MS?
I think it's important to establish realistic expectations and then compare that to what employment duties actually are. So every job is different, right? Where certain jobs are more impacted by physical demands, or others are more impacted by cognitive demands, and kind of fitting that with what one's own MS looks like. It's important to just review, your current job situation and just determine for yourself what proportion can you actually reasonably commit without burning yourself out. As it relates to work, I do encourage patients to look at benefits. So that means that, consider meeting with your HR department. So you don't need to necessarily disclose just to be able to know what the benefits are, but you should be knowledgeable about the policies that pertain to sick leave, even short-term or long-term disability, and whether or not there's ADA regulatory protections that can be helpful down the line. I think related to work, I would also suggest, when the time comes, if the time comes, just brainstorming reasonable accommodations. So these are ways that patients can tap into the flexibility and basically necessary adaptations to kind of carry out job-related activities. So I will comment that it's not the employer's responsibility to identify and offer solutions. Instead, it's the patient. So again, turning it back on the patients we care for, thinking about whether or not you would benefit from teleworking or even flex time so that you can prioritize medical treatment, whether or not, frequent breaks would help minimize fatigue, even whether or not you need adaptive office equipment just to minimize physical strain. These are just some of the options worth exploring with your MS specialist.
Well, a moment ago, you mentioned disclosing your diagnosis. What are the benefits and consequences of disclosing an MS diagnosis in the workplace?
Yeah. Oh, this is a difficult question to answer, but I think, disclosing the diagnosis of work, we have to be prepared to just address all the visible and also invisible tolls of the disease with others. I guess starting with the benefits of disclosing, again, you can then request reasonable accommodations with medical justification. I think also with disclosing, you can head off concerns about job performance before supervisors or managers potentially take disciplinary action. It's a lot harder to do the other way around, right, where you disclose after there's already changes noted. I think disclosing can also benefit if there's, loving, caring people who can provide support and make you feel like you can still endure as much as you can. So I guess contrasted to potential drawbacks of disclosing, like being potentially subject to stereotypes. The patients who don't disclose kind of share how, they don't want to be looked at as someone who can't keep up or someone who's going to be frequently absent. And they don't want additional opportunities taken away from them, right? Because people are wrongly assuming that they don't want to advance. So those are typically the things that kind of prevent people from disclosing. Ultimately, though, I think it is a very individualized decision that should be looked into earlier rather than later, just so that you can maximize options and even kind of consider what the financial consequences ahead might look like.
People diagnosed with MS can feel a wide range of emotions, and some people will wonder if that's normal. What are some of the emotions that people might experience when they receive their MS diagnosis or when they face a new challenge down the road during their MS journey?
Yeah, so there is a whole range of emotions that accompany the new diagnosis, and all the, actual and even theoretical changes that follow, from disbelief to shock. Some people even experience relief, right? Because they've been looking for answers and finally able to secure a label. Some people get frustrated, angry, ask why they're the ones being affected. A lot of patients, unfortunately, do suffer from worry and anxiety, even sadness and depression. So even with these emotions, they evolve too as one kind of adjusts to the diagnosis and the associated consequences on how it affects one's identity and self-image. And then while these emotions are coping responses, right, to the diagnosis and to the change ahead, as an MS specialist, I do think I am responsible for evaluating if these emotions become, disabling or mood disorders, because then we can try to track them, monitor them, and try to make impactful management choices to lessen their negative impact.
People living with MS and their loved ones may find that the uncertainty and changes of living with the disease can be overwhelming. The key to coping with these challenges is adopting behaviors that promote resilience. Can you tell us what resilience is and why it's so important for someone affected by MS?
So let's be real, right? Bad things happen all the time. Even right now, right? We're living in a world forever changed by the COVID-19 pandemic. So, if I were to think back to 1 year ago, I still have the raw reminder feeling like, oh my God, I can't do this. I can't uproot how I practice. I can't balance work and home life. It's just too much. But, somehow with each day, I coped and I found ways to endure and actually be more effective. So while I don't have MS, I just kind of speak to the same resilience, right, that empowered MS patients definitely possess. How I kind of look at resilience is the ability to withstand difficult circumstances with ever-growing strength, right? Knowing that you're stronger and more flexible with things that happen. And I think it's a vital skill to develop, just because, life is just going to keep throwing challenges at you, with or without MS. And it's a skill that forever is in development. So to be able to grow past adversity.
Can you share some strategies for building resilience?
Yeah. So you guys don't know me, but I'm all about quotes, right? That's how I find meaning. So kind of thinking about resilience, 3 quotes come to mind. The first one actually sits in the exam room of my mentor, and the quote is, "It is what it is." Okay, so resilience basically is letting us experience the natural ups and downs of life, right? Especially with MS. It does not mean being happy all the time. It does not mean that you have to always be on. It does, however, mean that things will be what you make it to be, right? So if you're not happy with things, change the narrative of your mind. Resist the tendency to ruminate on negative thoughts, and instead explore how you can potentially grow, right? And the opportunity that can come from adversity. A second quote, change is inevitable. Change is constant. So I know that many of us function out of routine, but the reality is circumstances are always changing around us. And in realizing that change is forever present, I think we give ourselves the room to kind of let go and forgive and be adaptable, so that we can exercise more self-compassion. And the last quote is one that I have at my computer, where, every day may not be good, but there's something good in every day. So speaking to the reminder that, there's always something worth living for, something to kind of push us through those challenging times.
Well, you've shared a lot of helpful insights with us today. What would you say are the top 3 takeaways that you'd like our audience to remember?
So I think the first would be, related to the seminar, right? Be a continual learner and ask questions. Maybe I'm biased because I practice at an academic institution, but I really feel that education is transformative and powerful. When I see patients and learners understand why and how, the lessons just stick. And it actually can help with, what's initially overwhelming and complicated become less so. So in this way, knowledge can actually provide a better sense of security and control in a field that's, forever advancing and evolving. I think my second takeaway was, surround yourself in support and know that you're not alone on this journey. I think by knowing that other people struggle, we allow ourselves to be more kind and compassionate, especially towards ourselves, and this amplifies our ability to be resilient. Lastly, I think why MS is so challenging and individualistic and unpredictable, and the potential risks with how to treat it. I instinctively think of gambling, and poker came to mind. So I guess my final takeaway message would be this. We cannot control the hand we're dealt in life, but we control how we play. So similarly, we can't change the MS diagnosis, but we can make empowered decisions towards wellness.
Well, I want to thank all of you who submitted your excellent questions, and thank you, Dr. Hu, for being with us today.
Thank you so much.
I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is credible and reliable. So we'd like to share some resources with you, and these are the resources that you can count on to be current and credible. I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. And I'll also remind you that the MS Society brings people together through peer connection programs like self-help groups, the MS Friends Helpline and Paired Program, and the National MS Society Facebook community. To learn more, please visit the Society's website at nationalmssociety.org/connections programs. And for additional information for people who are newly diagnosed, please visit the MS Society's website at the URL you see right on your screen. Every week on the Real Talk MS podcast, I continue the conversations that we start here. So I hope you'll take a few minutes to give Real Talk MS a listen. You'll find the Real Talk MS podcast at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, really wherever you find your favorite podcasts. Walk MS 2021 is coming, and this year, Walk MS will meet you where you are to connect, celebrate, and make a difference like never before. For more information, please visit walkms.org. And you can connect with the National MS Society along with others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. I encourage you to like the posts, subscribe to the channels, and make sure that you're on the Society's mailing list so you'll continue to receive the latest information on MS and updates on upcoming programs like this one. And I'd like to thank Dr. Nancy Hu for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/msexpert, as well as on Facebook and YouTube. I hope you'll join us for next Friday's edition of Ask an MS Expert, when we're going to be talking with Dr. Dorling Kimbrough about everything you need to know before you get your COVID-19 vaccination. And now I have a favor to ask each of you. Getting your feedback on today's webinar is important. So you'll see a survey pop up in a moment when we close out the webinar. And if you're watching on Facebook Live, you'll see a link to that survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute. So I hope you'll take that minute and fill it out. On behalf of Dr. Nancy Hu and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.